Now listen up, if you're taking your ARVs and you notice that your body is not responding properly to this medication, or maybe your viral load is not dropping the way it should, or maybe the way it's expected, don't worry. In today's video, I'll be explaining reasons why your ARVs medication may not be working properly. Now let's get started. Now the number one reason why ARVs don't work as expected is missing doses. ARVs needs to maintain a steady level in your bloodstream to keep HIV under control. When you regularly skip doses, maybe you take your medication on Monday and you forget to take it on Tuesday, you don't take it on Wednesday, you remember to take it on Thursday. When you consistently skip doses, the amount of medication in your body drops, and this gives the virus chance to multiply. Sister, brother, even if you feel healthy, you don't feel sick, you are healthy now, you don't feel any symptoms at all. When you frequently miss doses, it can increase your viral load and make treatment less effective. That is why consistency is so important. You can set reminders even if maybe you use alarm, because some persons they forget a lot. So if you can put an alarm to remind you when to take your medication, that will be better. Also, you can use this pill organizers also to make it more easy for you to easily have access to your drugs, or even linking your medication to a daily routine that can help you to stay on track. The second reason is HIV drug resistance. Now listen up. When HIV is allowed to multiply because medication is not taken consistently, the virus can change and develop resistance to certain drugs. And when that happens, the medication may no longer be able to control this virus effectively. But the good news is that healthcare providers can actually run tests to check for resistance, and if necessary, switch to another treatment regime that works better. Another common reason is drug interaction. Now, many people don't actually realize that when you take some certain kind of drugs, whether supplements, herbal remedies, they can actually interfere with your ARVs. These products may reduce the amount of HIV medication in your bloodstream, making treatment less effective. This is why you should always talk to your healthcare providers about every medication you're taking, whether it's supplement or herbal products. Never assume that something is safe just because it's natural. It doesn't work that way. It can actually interfere with your HIV medication, making it less effective. And number four, not taking ARVs as directed. Now listen up, sometimes people take their medication every day, but they don't follow the specific instruction that comes with it. Some ARVs needs to be taken with food, while others was based on an empty stomach. Now you need to understand that if these instructions are not followed, your body may not absorb this medication properly. As a result of this, the drugs may not reach that level needed to suppress this virus effectively. Now the final reason is absorption problem. Now listen, certain illnesses, maybe if you suffer from severe diarrhea, vomiting, or some kind of a digestive condition, all these can make it harder for the body to absorb this medication. So even if you are taking your ARVs correctly, you take it at the right time, your body may not be getting enough of these drugs into your bloodstream. This is why regular clinic visit and testing your viral load regularly is so important. So how do you know if your ARVs is working or maybe it's not working? Now listen up. Many people think that they will always feel sick if their medication is not working, but in reality, that might not be actually be true always. The best way to know if your ARVs are working or if they are not working is through a viral load test. That's the way to know. It's not by checking if you're sick or if you're not sick. Even if you're HIV negative, sometimes you feel sick. That is human for you. That is living things for you. You can fall sick. Sometimes you're healthy. Sometimes you're unhealthy. So it's not by checking when you fall sick. No, it's by checking your viral loads, running this test to know how many copies is there, if it's coming down or maybe it's increasing. If your ARVs are working properly, your viral load should become very low or even undetectable. That is why routine monitoring is an important part of HIV care. Now we're answering some questions I know that some of you might be curious to ask. And number one question says, is it better to take ARVs in the morning or at evening? Or do ARVs needs to be taken at a specific time of the day or maybe a specific hour of the day? The truth is that there is no universal rules that say that HIV medication, that's ARVs, what's best in the morning, or maybe what's best at night. The best time to take your ARVs medication is a time that you know that you can consistently stick to every day, like the time that you know that it's convenient for you to take every day. However, for more effectiveness, you should take your ARV at a particular hour or maybe a particular time each day. This helps to maintain a steady level of the medication in your bloodstream, allowing the drugs to continually suppress this virus and prevent this virus from multiplying. Now, if your prescribed time is 8 a.m., try taking these drugs 8 a.m. every day. And if you prefer 8 p.m., maybe prefer any hour of the day, stick to it. The major thing is that you remain consistent, taking it at a certain hour of the day and you don't skip it. Many modern ARVs are forgiving if maybe you're occasionally 1 hour or 2 hours late in taking your medication, but frequently taking doses are several hours late or missing them altogether can reduce effectiveness, and this can cause drug resistance. And number two question says, can alcohol make my ARV stop working? Alcohol usually doesn't directly stop your ARVs from working. But you need to understand something. Both your ARVs and alcohol are processed by the liver. So chronic heavy drinking stresses your liver and can damage your liver, which can increase your risk of advanced side effects from your medication. So it's best to stop taking alcohol when you're on this medication because alcohol stresses your liver. Now, for personalized advice on how alcohol can interact with your treatment, consult your healthcare provider, your doctor, or your pharmacist. Now, if you have concern about your treatment, maybe you notice a certain kind of side effect, don't stop taking your medications. Rather, speak to your doctor. If it's something that they can change, maybe change it to another form of treatment for you, then make sure to talk to your healthcare provider. Don't just keep calm and don't stop taking your medication either. Many people living with HIV achieve undetectable viral load and live long and healthy. It's not a death sentence. All you need to do is to be consistent with your treatment. Now, if you find this video helpful, don't forget to give a thumbs up, like, subscribe, and share. Bye.